and your weight. How do those things mesh? You see, when apnea first became diagnosed, the stereotype that followed was that it was a middle-aged, overweight man's disease. Ladies didn't have it, skinny people didn't have it, and that was a massive stereotype that lasted for decades. But now, with the most recent research, we realize that apnea is a highly genetic disease that has much more to do with the collapsibility or floppiness, if you will, of your airway than it has to do with your weight. Even though additional weight can be a symptom that causes early onset apnea. So we know that weight and apnea are correlated, but what I'd like to talk to you about more is how apnea is directly affecting your weight. So you see, if you have obstructive sleep apnea, during the night, you have an off-balance metabolism, if you will. You see, when apnea occurs and cortisol is introduced into the bloodstream in order to wake you up throughout the night, we know that the effect cortisol has on the body as a stress hormone is making food turn into fat. It's the quickest way to metabolize or process food. When our body has increased levels of cortisol consistently in the bloodstream, we often find that people will crave simple carbs, things loaded with sugar and things of that nature, so that we can actually process those much quicker in our body and store them as fat. All of those things make sense. The other component of apnea that many people haven't talked about is the fatigue component. You see, when you're constantly tired, you don't feel like getting up and going and working out. Your body is actually in a crisis mode where it's working overtime, if you will, laying in bed. Heart rate's often jumping to higher than you could produce if you were sprinting on a treadmill. Yet, we're laying in bed and obviously not losing the weight because we're not actually doing the cardiac exercise needed to keep our heart at that level. So with apnea, it's important to understand that yes, weight can be a contributing factor to having apnea, but it's not just overweight people that have it. Many slender people have apnea and are completely unaware. It has to do specifically with the anatomy of your airway and if it collapses. If it does, it's throwing off your hunger and full levels of hormones in your body and also producing cortisol, which makes us store food as fat. So again, talking about impacting that cycle of apnea, if we can stop the apnea by treating it, we can often reset that metabolism structure. Instead of having cortisol released in our bodies, we can go back to a normal state, which is not stressed, and have normal hunger and full levels again, therefore helping people to lose weight. So one of the screening questions that many doctors have employed is asking patients if they have trouble losing weight when they're trying. Obviously, exercise and food have a lot to do with that, but how we sleep matters as well. You see, sleep is the foundation for life. And if that foundation is cracked, like we're talking about with sleep apnea, it will affect everything in your body, including your weight.